Okay, so this is called a syringe pump. This actually will hook into the Alaris pump. You can see here, it slides right into a pump on either side. And this is so nice for kiddos because sometimes you have a little bit of medicine that needs to go in over a very long period of time. And rather than you sitting there and like trying to figure out how hard to push every couple seconds, this machine will do all the heavy work for you. So this one is outdated compared to what you're going to see in the hospital. I'm just going to let you know that right now. However, there are pieces of it that are still applicable, and that's what I want to show you. So you won't see this little piece here anymore. That's the biggest part that's different. But you're still going to give medicine with syringes, and you can do different types of syringes. I personally like to put a IV port on my tubing, at the top of my tubing, just because I can clean it easier. And it's, you might see nurses that just use it like this, but this isn't cleanable. This has a direct hole right into the patient. So that's why I like to use the IV ports at the top of them, because you can clean it every time you connect a new medicine. So I have my syringe that I'm going to administer medicine to this patient. I would have cleaned my port, and now I can connect my syringe, the syringe pump. And you're like, how in the world do I do that? I'm going to show you. So there is a little gray foot here. You can kind of see it, keep tilting and moving. It's a tiny little foot, and it has a little bit of space in it. That is for the edge of this syringe. So it's actually going to sit, and kind of see it seated in there. It's going to sit right there. And how do we hold it in there? Well, that's a great question. You're going to turn, so this pulls in and out. So you're going to pull it and set it here. Now I don't have to hold on to my syringe. And then in order for this to work, this little claw has to open up, and this claw is going to sit right below the edge of our plunger, because this is going to be like our hand or our thumb pushing that medicine in. So this turns, you're going to lower it down, and sometimes it gets a little stuck, so you have to be a little gentle so it doesn't disperse medicine. But you literally are going to grab the edge of the plunger here, and now you're all ready to set up your pump, and your instructor will show that to you at clinical. And then this is obviously the patient side. The medicine is always make sure this tubing is flushed through that with saline, and then you can attach your medicine to it, and the machine will do the rest of the work for you. It's fantastic.